Hi, it's Emily from Kibworth Osteopaths. I hope you're having a super day. So this is going to be a slightly long video. We're going to be considering the TMJ, the temporomandibular joint. So we're going to look at it. We're going to look at ways that we can stretch it, mobilize it, and strengthen it. So sit down, strap in, buckle up, get comfy, and let's dive straight in. So I'm going to spin you around to begin with so we can look at the TMJ. So this is the TMJ. Now, it's not a particularly big joint, and in between these two bony unions, we do have a tiny little interarticular disc, which, like all of the discs, can wear, become sore, become inflamed, but so can the joint itself. Now, in terms of other joints in the body, it's quite small, but my goodness me, can it cause some issues? So there's a blog accompanying this video. But as you can see, the TMJ literally bolts the bottom jaw onto the rest of the skull. So it's got this tiny union and this massive job. There's lots of reasons why a TMJ can become sore, and I'm not going to go into all of them because you know what, we'll be here all day plus forever chatting about it. But the most common one that I see in clinic is stress, okay? And then after that, it would be trauma. So that's what I'm considering for the purpose of this video. So that any other abnormalities with the jaw, be it congenital, be it through surgery, be it through dentistry, that's not what we're discussing here, okay? So what I'm looking to seek and influence is dysfunctional sore jaws caused through stress and perhaps trauma that's maybe historical and recovering. If you're not sure, go and see someone, be it an osteopath, physio, chiropractor, and definitely a dentist as well. They'll be able to tell you. So now we know where the jaw is, and now we know what it does. How do you know if it's causing you issues? Well, firstly, most commonly it aches and it can be sore. And secondly, you might feel it's clicky or a bit stiff. Now, full disclosure here, my jaw is a real source of problems for me. I'm constantly seeking to work on it because for me, it limits my mouth opening. My amazing dentist, what a saint, bless him, has to put up with me. And it hurts and it clicks and it aches. Now, why does it do that? Now, historically, I used to be a serial teeth clencher. My teeth together all the time. And I've worked really hard over years not to have that habit, to maintain the space between my teeth. So it's recommended to have 2 to 4 millimeter gap, also known as your freeway space. And I also wear a mouth guard on my bottom teeth at night. Now, it's the thinnest piece of plastic ever, so comfortable, but it really helps maintain that space when I'm not consciously aware of what I'm doing. So if you know that that is an issue for you, teeth together, one, tune into yourself. Are they together? Okay, fine, don't give yourself grief, but then give yourself that space and go and see a dentist and ask them to either make you a mouth guard through some molds. If they don't offer that service, ask them to refer you into maxillofacial, also known as Max Fax. So that'd be my first tip with teeth clenching as a habit, and obviously working on maintaining that space. The other things that you can do, so I'm going to start off with some soft tissue work, okay? So you can do both sides at once, you can do one side and the other depending on how sore your jaw is. So both sides at once, I like this position and I use the flat parts of my fingers, so I'm not pointing, I'm here and I'm not putting any driving pressure in, okay? So it's enough pressure, so if we're talking out of 10, I would say 4 to 5 out of 10, and I'm doing small circles to begin with, just over my TMJ. Now, because I do this for a living, see where my thumbs are underneath my jaw, I've got a little bit of pressure. And now what I can do with those is I can start to draw my thumbs down, which puts a bit of a stretch through the muscle. So I'm doing 3 things at once here. And now what I might choose to do is a good 30 seconds to 2 minutes of this, depending on how sore it's all feeling. Now you can keep it here. I like to move around because the muscles that move and control the jaw are really strong. So powerful. So I like just to be a bit more mobile in my approach. I've took my thumbs out of action here. So my thumbs are only in drawing down on the inferior part of these muscles here, as and when I feel I need that. So the other thing you can do massage-wise is get into temporalis, which is huge. The temporalis sits around here. So I like to start in and around here, I'm going too fast here because I don't want to bore you, but I would sit with this for a good while, maybe even 3 minutes or so. Just be careful if you're headachy or prone to headachy, you might just want to do one side at a time on this. And if you find a sore spot, sit with it, just gently move it until you think, okay, yeah, that's feeling a bit easier. So that's all these big muscles at the top of the jaw worked into. A little bit underneath. Now again, underneath, what you can do is using the blades of your thumb, we looked at this just a few minutes ago, is you can just put a slight draw. So if that's the chin, you might just draw forwards just a little bit, just to create a bit of a stretch through the muscles that sit underneath the chin, and they can get quite sore. So I'll just do this as a gliding movement, just to really try and lengthen that through. And I'll just do 3 of those. So we've got lots of massage work done. Now we have got muscles that we can access from inside our mouth, okay? Now this is a little bit awkward, a little bit fiddly, not the prettiest technique to do or seen be done, but we're gonna go for it. So these muscles are called your pterygoids, and they're strong and they're powerful, and they're usually a bit tender. So how do I access my pterygoids? I'll use this, and I slide. I'm going to go on the outside bit, actually you should be inside, so I'll show you both. So I'm going to slide along the row of my bottom teeth until I drop off. So around there. And if you press down and a little bit up, they will be a bit tender. Now the idea here is not to make yourself feel sick, so you're not going down the back of your throat, you're very much along the line of the teeth and down. And then once I access my pterygoids, you've got uppers and lowers, I'm just going to gently press in a slow pulse, anywhere between 5 and 10, but I'm not holding or maintaining that, I'm just being really gentle with that. So obviously your fingers are going to be on the inside of your mouth doing that, okay? So just to show you just one, I don't want to bore you, been here for a while as it is, and we've still got some time to go. So in, slide off, and there's your pterygoids, they're strong, like that. The upper ones tend to be the more painful, okay? So one on each side for that, obviously don't do both at once on that, it's going to get a bit uncomfortable. So that's the soft tissue work. In terms of mobilising, okay, for me, I will personally support my jaw with mobilising, okay, because it is a bit temperamental. So I will open and I'll just have a little bit of a handhold here to support my jaw. So I'll open and close, trying to hold it for up to 5 to 10 seconds, trying to get a little bit wider each time. It's a big thing for me to try and do this, so it's a bit boring, isn't it? Okay, so once I've done that, I feel I've mobilised my jaw. I'm going to do some deviations. I'm going to put a bit of space between my teeth and go side to side. And I might do 5 to 10, just gently, so hold and hold. So from that, we can use that to create a little bit of strength and stability in the jaw. I'm just going to look at 3 or 4 exercises here. So with the deviation, what you can do is with a flat hand is just push into a little bit of resistance from this hand. So the movement's not as big, so I'm trying to push my jaw this way. My hand's resisting. And that just helps build up the ligament and the muscle strength. So for the strengthening work, I will do about 4 or 5 to each side. And just go, okay, is one side better than the other? Have I got an area here that needs a bit more work? And again, you can resist some opening, so I'll just use thumbs and try and resist that as well. Okay, and again, 4 or 5 of those, 10-second hold. That one is quite a bit easier. The next strengthening exercise is quite weird, so just bear with when I try and explain this. This isn't one that you can see, this is an inside technique. So you get your tongue to the roof of your mouth, okay? And then what you're going to try and do is with gentle teeth together, like that, tongue to the top, you should try and roll your tongue along the top palate until the teeth come apart, and then you hold that for 5 seconds. So this always makes me on this one, but I'll show you anyway. So teeth gently together, tongue to the roof, roll it back, teeth apart. And then when you're there, you try and open your jaw. Relax. It's a really good strengthening exercise for here. So I'll do that maybe 5 to 8 times, okay? It's a bit weird, takes some work, that one, but it is a really good strength and stability exercise, that, for the jaw. Give it a go and you can really feel it. So that's my little jaw routine that I do. Other things that I do, I use ice packs if it is feeling particularly sore or inflamed, and some heat if I'm thinking, oh, it's just a bit achy and tired, I've been rabbiting on all day at work. You might see people advise like Voltarol gels, and as you all know, I love BioFreeze Roll-On. I think it's brilliant, but personally, I'm a little bit picky what I put on my skin, especially on my face. So I don't tend to use products as such onto it. I will just go for ice and heat so I don't irritate my skin. So that's me in a nutshell with the jaw. There are obviously lots of other things that you can do, so explore those as long as they're safe. So some people will take anti-inflammatories. Not an ideal long-term solution, but it is okay if you've had maybe quite a lot of dental work done recently, your jaw's feeling a bit sore. That could be something you can discuss with your GP or pharmacist. Some people are exploring other treatment options, which I'm not going to discuss here today because we've gone way over time and I've kept you for ages as it is. But if you have any questions on the jaw, check in, ask me, send me a message, and definitely tap into your dentist. They are a phenomenal resource. Massive shout out to my dentist Ravi at Brookside. You have the patience of a saint, and as you can see, I'm trying so hard to get this jaw to behave. Have a great day, and any questions, as always, I'm right here and happy to help. Take care.